Um, One, how do you handle a patient who is being aggressive or shouting at the front desk? And this question involves, to answer this question successfully, you have to acknowledge the fact that you must stay calm in all scenarios. When a patient shouts, it's usually because they have fear, they have panic, they have anxiety. It's almost never directed at you personally. It's because the patient will be in a state of mind. The second point is you maintain a calm, low volume voice and speak to the patient politely. In your brain, you must always follow the protocol. So if a patient is shouting, try to nicely listen to them, acknowledge their emotions by saying, I can see why this may be stressful for you. And within the protocol, try to offer them a solution. For example, you could say that you will ask a manager to talk to them um, fairly quickly. You can offer any solution based on your training and protocol, if there is a solution. And the key is to maintain calmness, because when a patient is angry, if you're calm, there's a chance that calmness would reflect on their empathy neuron, and it will also calm them down. There's a good chance that may happen. You have to maintain being polite and professional and having a calm voice at all times. You must not lose your cool. This is a very important situation to stay calm in. Next question. A patient calls with chest pains. What is your immediate course of action? Chest pain could be a variety of things, but if it's cardinal to heart attack symptoms, for example, a pressure on the chest, you will have to ask the patient, because this question says calls, you should ask the patient to stay on the line, like you could hold it, and then ask them to call 999, because this is not a standard patient. This is a emergency scenario. You do not hold the phone, you keep the phone on. They'll call ambulance, and the ambulance will assess them quickly on the 999 call. Tell the patient not to avoid calling the surgery again. They can call the surgery again, just at least call 999 and have it verified by ambulance first. Another scenario is stroke. So if they have slurred voice, and it's a new phenomenon, if they're talking about the fast things like drooping face, you immediately tell them to call 999. In a stroke scenario and heart attack scenario, if I'm very sure they're having it, I might have to call 999 myself in case they don't do it. I don't know how this will occur, but if it's a really bad scenario, like they could die, I might have to help additionally if I think they might not do it properly. In this scenario, you should document it, so when the duty doctor comes, you can inform them of why you told them to call the ambulance through 999 first. It's good practice. Next question. How do you manage a situation where the clinic is running 45 minutes behind schedule? 45 minutes behind schedule is for a patient, it may be a significant amount of time. The key in this scenario is communication. When the patients come, just inform them that their appointment will be 45 minutes later than usual. So you should offer them to go for a walk and drink coffee, so they do not get stressed out during the wait. Next question. What does patient confidentiality mean to you in a practical sense? So practical means something like pragmatic, like realistic. Patient confidentiality means do not leak information. Practically, this will involve not discussing patient in the hallway of the surgery. When you're using the monitor, ensure that patients cannot see the monitor. If they see the monitor, that's a big no-no. If a family of the patient is demanding access to confidential information, family is not exempt. They need only the patient can get the personal details, not the family members. Confidentiality is a very important thing. Other ways, basic ways, is don't share on social media, don't use USBs, use NHS email, lock the documents, like this patient files, make sure that it's locked, especially when you leave. Turn off the computer, like make sure it's password locked whenever you leave the reception area. And as of lately, when you're entering your receptionist, there are some extra security things, like to make sure you're not being followed when you enter the reception area. So things are a little bit different now. It's more intense now. How do you prioritize tasks when the phone is ringing, a patient is at the desk, and the doctor is asking for a file? So I repeat, phone is ringing, a patient is at the desk, and the doctor is asking for a file. This is a triage question. Well, it's a type of triage question. Usually, the key to this answer is you have to prioritize the essential first. Usually, when a doctor is asking for something, usually in significant number of scenarios, that's the highest clinical need. So this is the procedure. You acknowledge the patient at the desk by looking at them and giving them a smile. The clinical need is usually most important, so when the doctor asks for a file, you should do that promptly because it's usually of high clinical need. And then after that, you address the patient that is ringing. So you pick up the phone and you address them. So that's usually the levels. I want to answer the first question and add a little bit more. In a situation where you think a patient will be very aggressive, it may be worth using the code word blue file. Could you give me the blue file to the accompanying receptionist if you have reason to believe that the patient may be violent? I'm not going to use this as a blanket rule for all situations where patients shout, and but there may be a small percentage, as a complete guess, maybe once a year or something, or maybe once every 10 years, where a patient may be aggressive. In that scenario, you should use the code word blue file or blue folder. Could you give me the blue folder, please? This is code for patient may be aggressive. I want to add more information to the patient confidentiality. Confidentiality is very important. If you breach it, the litigation circumstances are quite high. So don't breach it. This is a cornerstone of reception work. There are scenarios, and I have to respect professional boundaries. There are scenarios where a patient may make, with a HIV or AIDS, may make threats about their spouse or husband or wife, like grievous bodily harm threats. I think I'll delegate that to the doctor. The doctor is best equipped with that. I don't want to go into detail. I know what the doctor may probably do, but I don't want to answer that in detail because I don't want to appear that I'm going to breach professional boundaries when I start working. I would immediately, promptly delegate it to the doctor. I'll probably have to go to the doctor in person and tell them what has occurred. Doctor is best equipped to deal with that specific situation. I'm not equipped with that situation. It's a very complex situation, like the HIV/AIDS one. Only the doctor knows the protocol in detail. It's a very difficult protocol, so I'll delegate it to the doctor. I'm not a healthcare professional. I'm going to be a receptionist. Thank you.